Well, welcome once again to this short presentation of positive health. It's a new concept of resilience and well-being from the Netherlands. My name is Angela Smith, and I'm here in Madrid now, representing on the one hand Gesundheit Aktiv, which is a patients and citizens association in Germany. And on the other hand, I'm also representing Positive Gesundheit Deutschland. We are like Positive Health in Germany, an association, a quite new association that is in very close collaboration with Positive Health International in the Netherlands, and we are trying to bring the concept of positive health to Germany and perhaps also now to Spain and to your country and to any country that is watching this presentation today. So, what is positive health? Let's hope that we can actually move this. No, doesn't work. Here it is. Positive health, on the one hand, is a broad vision on health. If you see here, this like spider web is a presentation of the tool that positive health uses, and it includes, say, 6 dimensions of health. So if we talk about 6 dimensions of health, you can already see that it's not only looking at health as the absence of disease, but it's looking at health in various aspects. It includes actually all aspects of life, I would say. Then positive health is a reflection tool because it helps people to actually reflect on their own situation, on their personal health, and to sort of get a different perspective on their own health. Then we also say that positive health is a driver of change because it can actually make a change not only on a personal level, but also on a professional level and on a whole systemic level in a region, in the whole country, and perhaps also in the world. In the Netherlands, basically, it has already contributed to a lot of change in the health system. The Netherlands now have a health system, or are still on the way to a health system that focuses more on prevention, and positive health is already included in about 3,000 surgeries in the Netherlands. So general practitioners actually work day to day with this tool. But it's not only in surgeries, it's also in schools, total regions in the Netherlands work with positive health, social workers, and so on. That can really make a change. And what it is also, it's a common framework. So if you imagine that a lot of different stakeholders work with positive health, they have a common view, a common language that they can communicate with. And so in total, it's a movement. And in the Netherlands, it is already a movement. And we hope that in other countries, it will also become a bigger movement. Well, actually, before I look at this, I would like to describe you a little bit where positive health comes from. So the person who's actually developed positive health at the beginning is Dr. Gemaakt Huber. And Dr. Gemaakt Huber was a doctor. Well, she basically still is a doctor, but doesn't actually practice as a doctor anymore. And when she was in her 30s, she struggled with various strong diseases. So for the first time in her life, her role changed completely from being a general practitioner to becoming a patient. And so this change of role actually changed her view on health, because, well, as a general practitioner, she realized that she knew an awful lot about illnesses. And that's what medical students in Germany, probably in the Netherlands, and probably also in Spain and in other European countries focus on. It's basically disease. So they know an awful lot about all the different diseases, but know very little about what is health. And so when Martha Truber fell ill, for the first time, she actually started to think about the question, what do I need? And how can I, myself as a patient, contribute to my own healing and to my own health? What can I do? And when she was in her mid-30s, she recovered. And that, but going through all this experience, she knew that she wanted to make a change, not only on an individual level, but also on a systemic level. And so to her, it was clear that if you want to change from a disease-oriented system to a health-oriented system, it's a complete shift. And for this, she knew it needs science, it needs investigation. And so she decided to actually enter into the field of science. When she started, she actually noticed that there was one problem, because she wanted the aspect of resilience to be part of the medical studies, to be part of the health system in total. But resilience is actually not recognized as part of health. And so it was clear that our health system, or what we call our health system, is basically a system of disease. And you can see that here very clearly. This is a representation that a representative of a health insurance in the Netherlands once showed to Martha Truber. He said, well, if you look at the triangle on the left, that represents the division of the costs of our insurance, or the money that we spend in our insurance. And the blue part of that triangle is the money that we spend on illness, or on the repair of illness, or the treatment of illnesses. And the bottom pink part is what we spend on prevention. So if we actually in the future want to have a health system that is still affordable, that needs to change. And so the triangle on the right basically is the vision of our future health system, how it should be. So that the pink part in future should be the greatest part of our of the expenses in the health system, and the blue part would then become smaller, because if people, well, obviously, if they care about their health, if there is health prevention, not health prevention, prevention of disease, then automatically you don't need to spend that much anymore on the repair or the management of disease. So I don't actually have the definition of health of the World Health Organization in this presentation, but what I've already mentioned is this problem about resilience. So when Martha started with her research, she was actually confronted with this problem. And she said, well, the problem is that resilience is not part of the definition of health in the World Health Organization. And the definition of the World Health Organization actually states that health is the complete, do you know the wording? I can't remember it now. The absence of mental, physical, and emotional problems, I say. I don't actually remember now the exact wording. But her big critique is that we never actually, or hardly ever, can have a complete absence of all the problems that we might face. And especially nowadays that chronic diseases are on the increase, we can't ever have total health according to this definition. And it encourages over-medicalization, because we always aim to have this complete absence of any problems. And so whenever we have some problem, we'll probably find a pill that would help us. So she had another suggestion for a new concept of health. And it's not a definition, because definition in itself is already static. And she wanted to give a dynamic concept for health. And so the suggestion that she gave was health as the ability to adapt and to self-manage in the face of social, physical, and emotional challenges. And this is basically what she parted from in her investigation. And she asked, she made interviews with about 50 interviews with about 140 people, so with individuals and with groups of people, to see what they thought about this general concept of health. And so in general, people were very agreed a lot with this concept. And for example, one of the replies was, well, you don't take health as an aim in itself, but as a means to lead a meaningful life. So it totally changes the way you look at health and the importance of health too. So that was one part of the qualitative research that Martel underwent. And another question, this qualitative research, was, what does health mean to you, or what are aspects that include health for you? And in total, they came up with 560 more or less aspects that people related to health. And all those aspects have then been divided into groups. And in the end, they came up with the 6 dimensions that are now also on the positive health spiderweb. It's the bodily functions, the mental well-being, meaningfulness, quality of life, social participation, and the daily functioning. So those 6 dimensions also have what I would call perhaps sub-dimensions that basically describe what aspects are part of each of the dimension. And from this, carry on. Now, here it is. So with these 6 dimensions, they then changed into a quantitative research. And they asked almost 2,000 people to check what they thought, if those 6 dimensions were actually part of health. And they asked, if you can see here on the right, they asked healthcare providers, they asked patients, and the patients were people with chronic diseases. They asked general citizens, policymakers, insurers, public health actors, and researchers. And basically what you see here is the result of this research. Interestingly enough, what you see here, the green line, these are the patients. And the patients actually include all the 6 dimensions in what is health to them and the importance for them, for their health. And if you look at the line at the bottom, these are actually the policymakers. So they are completely different to the people who are actually suffering from disease. And you can see also, for example, yellow, these are the insurers. Oops, that was not meant. Okay, or we have here in light blue, the researchers. And here more at the top, you then see like the healthcare providers and the citizens too. So what this graphic shows very clearly is that the closer people or professionals are to the patients, the more they are in line with the patients. And the further away they are from a direct contact with the patient, the less they actually recognize all the other aspects that are part of health to the people who actually have to deal with health issues. Yeah, and here you now see the spider web as it is, well, the official spider web today. It includes the 6 dimensions that I've mentioned before, and each of the 6 dimensions has like so-called, well, I would call them sub-dimensions that basically describe what is part of the general dimension. So if we look at bodily functions, for example, feeling healthy, feeling fit, no physical complaints, sleeping, eating, sexuality, physical conditions, all are part of the bodily functions. And so now this spider web, as we call it, is a tool that can now be used with patients, with clients, with anyone to get an overview of how people feel themselves and how they actually feel their health. So the idea is here, if you look at, for example, bodily functions, again, you have this line that starts in the middle with 0, and right at the outside part, you see the 10. So if you feel, for example, that your bodily functions, you feel very bad, you feel terrible, you would give yourself 0. If you say, well, I'm totally fit, there is nothing in bodily functions that is in any way a problem to me, you could give yourself a 10. And so you just give an estimate of how you feel in each of these dimensions, and you basically make a cross there, and then you combine the crosses on each line and you get something like, for example, I'm showing here. This is now the Spanish one, but it's the same thing, just the language is the difference here. So for example, here, this person would sort of feel okay about their physical condition. And if you see here the part of participation, they probably don't perhaps are not in contact with that many people, and so on. But here you get a general idea of how this person feels about their own health. So what is the essence of this spider web? It's an own assessment of the personal situation. So you look at your own health, well, from a different perspective. And the only thing that actually matters is how you yourself feel about it. And with this, you create what we call a health surface. And if you then go into a dialogue with a doctor, with a therapist, or whoever, then the person can ask you, do you want to change something? And if so, what? So it's about, if you want to change something, nobody tells you that you have to change anything. And you yourself decide what you change and if you do that. And as an example to understand that, if you have a look at this one, at the one before, if I was a doctor, I could very easily say to this person, oh, you know what? I think you should, I don't know, perhaps join a club or a choir or something, so you meet more people, because I can see that the part of participation is not very good. It's not good for you. But maybe the person who's filled that in doesn't have a problem with it, quite likes to be on their own. And they think that their physical condition is much more important. They say, well, actually what I want to change is I want to do more exercise. So that's a bit the idea of this spider web. So, and then once you have this overview and you've decided you want to change something, then it's actually up to you to take some actions. So how we work with spider web is, with the positive health spider web is, first of all, you get a broad reflection on your own life in general, and that's your own spider web. And then you enter into an alternative dialogue or a different conversation, a different dialogue, where it really matters what you really want, or as Machteld would say, what brings your eyes to sparkle, what makes your eyes sparkle, what is your dream, and what would you like to change? And then you start going into practice, and perhaps with the doctor, with the therapist, or whoever, together you then decide what changes you can make yourself. And the therapist or the doctor actually takes on the role of a coach, who just helps you to find your own solution. Yeah, positive health is also now in the National Health Policy document, and if you look at this, representation here, that was not okay. You can see here the 6 dimensions of positive health, bodily functions, as an umbrella for the whole system. And you see here on the left the underlying problems, and positive health can be like an umbrella that helps to tackle the problems already on a more national level here. No, can't something, sorry, here we are. Positive health, what we have seen now is more the use on an individual level, but it can actually be part of the whole system. And so you can see here this triangle with, once again, different colors here. Here at the bottom, you see what is the citizens. So the individual that can use positive health, that feels more heard, that enters into a different dialogue, that gets an idea of their own situation, people who work with positive health on an individual level often also get more job satisfaction. Then if you move up the triangle, you get into the part of the practice, and practices that work with positive health, they actually start to look at the way they work differently. And then it can move up to the local community and finally to the whole region. So just before I finish, also in the Netherlands, there is the Handbook Positive Health in Primary Care that describes all the history and how to use positive health. And that has already been translated into English. And last year we finished the translation also into German. And perhaps in the future there will be more languages available. And if you are interested to learn more about positive health, you can request a presentation, or you can visit our website. The German website is only in German, so I think the website of Positive Health International applies more to you. So that's positivehealth/international.com. And finally, if you have more questions or you want to get into conversation with me, here you find my email address at Gesundheit Aktiv and also at Positive Health in Germany. Yeah, so far I would like to thank you very much for your attention and hope that this small presentation has given you some insight into what positive health is, and perhaps has given you, well, has motivated you to start working with positive health yourself.
Thank you very much. It was very inspiring, and we're going to buy the book.
Wonderful, wonderful. Great. Thanks a lot.
So I think Angela should hurry back to the lots of people there are waiting.
Yeah, yes.
Angela, can I ask you?
Yes.
You speak so many languages, so good.
No,
where do you come
not
from?
that many, only 3.
Yeah, but English and Dutch and Spanish, like it's your mother language, all of them. Are you from Britain, or are you?
No. I'm German. I'm German, okay. But I lived in England for 6 years, studied there, and I lived in Mexico and studied Spanish and English. So
okay, then you explain it.
Right. Pleasure.
Thank you very much, and enjoy your evening in Madrid.
Thank you. Bye-bye.
Thank you for joining as audience. Yeah, thank you very much.
Yeah.
Yes, we'll send you, when it's edited, we will send it to you.
Yes, that's good. Thank you.
Okay, and thank you for being in the audience today, twice. Okay, have a wonderful evening. You, bye-bye. Bye-bye. Salir is eruit gaan, toch? Ja, wacht even. Finaliza para voor iedereen. Ja, iedereen. Gaat hij dan vanzelf... Maar hij neemt al niet meer op. Oh, nee, klopt. Hij is al gestart. Ja. Oké, dan hier wacht. Hij neemt nog wel op. Nee, zo is het wel. Seguro de que se detener. Nee, wat is dat? Of ik stoppen met opnemen, toch? Ik weet niet of hij dat zegt. Shit. Dus... Dit is volgens mij opnemen namelijk. Ja, het heeft gezegd, stop recording. Dat heeft ze al gestopt. Oh, maar hij loopt nog. Are you sure? Ja. Hier. Ja. Timer app. Nee, dat is de duration. We gaan een pauze zetten. Ja? Niet dat hij nou reageert. Pauze, grabation. Alt P.